Dr. Foluke Ayeni is a lecturer and researcher in the Department of Clinical Pharmacy and Biopharmacy, Faculty of Pharmacy, University of Lagos. She holds a PhD degree in clinical pharmacy and has about 15 years experience in clinical pharmacy-related research. Her research interests are in the areas of public health, infectious diseases, and the relationship between communicable and non-communicable diseases, with emphasis on tuberculosis and diabetes mellitus. In line with her research interest, she has several publications in peer-reviewed national and international journals. Dr. Foluke Ayeni has mentioned and has monitored and supervised over 20 undergraduate students and 5 postgraduate students at the master's level. She's currently supervising 4 undergraduates, 1 master's, and 2 PhD students. Dr. Foluke Ayeni is a member of the Pharmaceutical Society of Nigeria, PSN, Clinical Pharmacists Association of Nigeria, CPAN, and the International Pharmaceutical Federation, FIP. Put your hands together for Dr. Foluke Ayeni as she takes us on the next workshop.
Good afternoon, distinguished pharmacists, our elders in the profession, ladies and gentlemen. I want to stand on all existing protocols. To start with, I want to appreciate the planning committee of this conference for bringing me here to talk on this topic, mining the treasures in community pharmacy practice through collaboration and research. So my job here is actually very simple. It is to stimulate our interest in research. And whether we like it or not, we all do research. We have this data sitting down with us in our pharmacies, in our homes. Imagine a woman who wakes up in the morning and is considering what to prepare for her children for breakfast. She does a little bit of permutation and decides to just make plantain and eggs because it will not take her more than 10 minutes to make as compared to when she wants to make a pot of rice. She has done it before. She discovered that making plantain and eggs would not take her too much time. And so she decides to go ahead with that on days that she's very busy and is in a hurry to leave home. That is a little bit of research. She has that data. Another person wants to leave home, and to get to your office, you have like 3 routes that you could take. And you think about it, you say, okay, route 1 will take me 5 minutes. Route 2 will take me 15 minutes. Route 3 will take me like 30 minutes. And you decide to say, okay, today I'm not in a hurry. Let me go the route that will take me 15 minutes to get to the office. That is as a result of a research you have done. It's a research. You have gone through route 1, route 2, route 3, and you have the data to show that this takes 5 minutes, this takes 15 minutes, and the other one takes 30 minutes. So we all do research in one way or the other every day. And as community pharmacists, we sit on a lot of data. So I'm here to convince all of us to partner with colleagues in the academia, colleagues in research institutes, and let's get this data out there to improve our practice and to inform policy. Let's look at this case scenario. We have this evergreen community pharmacy. It is a busy independent pharmacy that is located in Oregun, a suburban community in Lagos State. The pharmacy has established a solid reputation for its commitment to patient care. It provides a wide range of services such as medication therapy management, immunization services, and chronic disease management, health screenings. However, the pharmacy team there, they have a couple of pharmacists working in the pharmacy. The pharmacy team realized that they had limited evidence to demonstrate the full impact of the services they have been offering on health outcomes and the broader healthcare system. They have the data but have not done anything with it. So in an effort both to enhance their services and improve their understanding of their own impact, Evergreen Community Pharmacy decided to workshop titled Mining the Treasures in Community Pharmacy Practice Through Collaboration and Research. The workshop aims to integrate research and collaboration with other pharmacists and healthcare providers to improve patient care and prove the effectiveness of the services through data and evidence-based practices. Now, the question is, at the end of this workshop, how would Evergreen Pharmacy go about doing this? I'm going to talk about it in just a nutshell. I've been told to try not to make it too academic, so I've tried not to make it too academic. I wanted to make it as interactive as possible. And before this talk, I sent out a Google form, which would have been sent to your phones. Please, I would, before I came up, I had about 23 responses. I would like us to fill that form, and we're going to use it as a point of discussion to demonstrate and simulate research through the data that you are providing. Because in your filling the form, you are actually giving me data, which I need to do the research I want to do. So going back to my topic, mining the treasures in community pharmacies through research and collaboration. I looked at the word community pharmacy. In a nutshell, I'll just speak to it. We are all, well, maybe not all of us, but we all know who community pharmacies are. We know the what, the who, the where, the why, and the when. Who are community pharmacists? We know ourselves, because as by association, I have now become a community pharmacy today. So, who are community pharmacists? We are the healthcare professionals who are most accessible to the patient in the community that we practice in and serve. The community pharmacy setting it has been recognized as an increasingly cornerstone of healthcare delivery within the community. It is the first point of call for patients with any health challenge, and they come there to seek solutions to the health challenges that they have before taking any other step of going further. The practice that we have in community pharmacy keeps evolving. In fact, the practice of pharmacy has evolved from the traditional dispensing that we have, and now we are in the era of pharmaceutical care, having evolved over time. The same thing with community pharmacies. And we have this multifaceted approach now that includes patient counseling services, clinical services, finding out the health outcomes of our patients, medication therapy management, helping our patients to use their drugs rationally, and then collaboration with other healthcare providers. With this evolving over time and integration of advanced pharmaceutical care, pharmacists in general are in a unique position to make a tangible difference and contribute positively to patient health outcomes through our expertise in medication management. How do we manage our patients? What data do we collect from them when they come into our pharmacies, either with a prescription or to seek counsel, to talk with a pharmacist? We have all this data, and like it said in pharmacy, any intervention done that is not documented is not done. So we have data sitting down and it's not being used in research, it's just there. But I tell you that if we harness this data and bring it out in research, we can inform policy and improve our patient health outcomes. Also looking at collaboration. Collaboration refers to the process where two or more individuals or groups work together towards a common goal or objective, pulling their resources together. I know a lot has been said about collaboration since this program started yesterday, so I'm not going to overflog it. But I just want to mention that as pharmacists, as community pharmacists, we can collaborate within ourselves. Just like our keynote speaker today said, we can collaborate within ourselves. We can also have interdisciplinary collaboration with pharmacists in other practice areas and also with other healthcare practitioners. And this we do so that our patients can have better treatment outcomes at the end of the day. And then looking at research, It is referred to as a systematic investigation or inquiry into a subject or a problem to discover the facts or establish or validate theories that have been made. So in doing research, there has to be a question that you want to answer. There must be a theory that you want to test. There must be something that you want to confirm. Maybe in a community you have heard that this community, over a period of months, they consume more of a particular medication, and you want to confirm if it is true. You go about it, design a research project, and then test that theory, or you want to answer that question. We'll see all that as we go on in this talk. Talking about mining the treasures, I've mentioned that we sit on a lot of data. And if I ask in community pharmacy, what is that thing that pays us the most? I know that we want to look at the product, we want to look at the profits that are coming in from the product, but like our keynote address of yesterday mentioned, I was privileged to join in and just heard him mentioning that he was able to collaborate with a foreign firm, and they paid him in foreign currency through a sort of research that he did for them. If we get grounded in carrying out research, we can disseminate such informations at the end of the day to either inform national policies or international policies. Majority of countries or even government establishments, when they want to embark on a project, they go out there to see what has been published in literature, what has been said regarding what they want to do. They take it up, and then they can now design their own research to test that theory or to confirm it, and then go ahead to continue with the program that they want to do. And this is how development takes place. It is as a result of finding out what can be done or what has been done, and then improving on it and implementing it for the benefit and the betterment of whatever situation they want it to address. And in our own case, it will be to the betterment of our patients, to inform better patient care. So in pharmacy practice, data refers to any collection of factual information that can be used to inform decisions. Like the Google form I sent out today, what you are giving me back is data. I will now organize it to find out the trend of the questions I've asked in that research. And that is how research works, basically. So and when this is done, it is used to inform decision, improve patient care, and optimize healthcare outcomes. Data in pharmacy practice is very critical for understanding medication therapy, patient behaviors, treatment efficacy, and health system performance. We can break all the data as we have down to address these different areas of research. And then in pharmacy, we collect different types of data. The different types of data we collect can be patient data that has to do with the patient's own self. We call it social demographic data. And then we can collect medication data. We want to find out what medication the patient is using and marry it with the comorbid conditions they have to be sure that every of their disease condition is being managed by a medication. And any medication that is not needed will be removed from the medication list. And any condition they have that is not being managed by a medication and is needed to be managed by a medication will be addressed. All this gives us medication data. We also have clinical data, the outcomes, operational data that has to do with the operation of the premises, of the pharmacy premise, patient-reported data, the data that patient gives us when they come in, and so on and so forth. We also have, very importantly, pharmacovigilance data. We have patients coming in to maybe complain to us on the outcome of one medication they've taken or another. We have the channels to disseminate this information, and we can also work on it to find out if there's a pattern in a particular region or within a particular time of the year where patients have more of these adverse events occurring. So, despite the fact that we have this data already lying down somewhere with us, there remains a gap in the consistent application of the collaborative care models and research-driven practices that can contribute to policies in many pharmacies. I want to say that the Google form that was being passed on, if I look at all of us in this hall, we are like close to 1,000 or thereabouts. But as at the time I came up here, we've had less than 30 responses. So that shows that we need to pay more attention to issues that has to do with research like this. Many times you would have had students coming into your pharmacy to bring in, to want to carry out one research or the other. They bring a questionnaire and ask for it to be filled. I would use this opportunity to kindly plead that please let us oblige this patient, these students that comes to us to fill our questionnaires. All the data they are getting from you are going to be used confidentially to draw a conclusion that will be put out there in literature for the betterment of patients or to inform policy as the case may be. So this is a problem. There's a gap, and that gap needs to be addressed. How do we go about addressing that gap? So for this talk, I just have these 4 objectives to talk about. Fostering collaborative care. We have heard a lot about it, so that is like a given. So I encourage collaboration between pharmacy teams and other healthcare professionals to improve patient care. At the end of this workshop, what am I going to do differently than what I've been doing? What are you going to do differently? That is a question and a food for thought. Also, the second one is to synthesize and encourage research in community pharmacy practice through the use of research methodologies that could be applied in the pharmacy settings. There are some researches that could be done quite conveniently in the pharmacy setting, especially community pharmacy. And these are what we are looking at when we are talking about encouraging research in community pharmacy. And then after going through this, we want to measure the impact. What is the impact of the research? What has been the outcome of the question we have set out to answer, or the gap that we have set out to fill? And then at the end of it, we want to build a framework for long-term research engagement. And this is where my work is, to encourage us. I know that the ACPN has a research platform being set up, and we can collaborate on this platform. We can come into this platform to find out our own area of interest. As we are here, we have different areas of interest. Some people have more interest in one disease state than the others. So your own interest, come here, form a team with people of like mind, and let's find out how we can further improve our patients that have these disease conditions, so that at the end of the day, they will have a better quality of life, and then we can also have more money in our pockets. So taking the first one is still talking about collaborative care, and I've said we can do either an inter-collaboration or an intra-collaboration within ourselves, within pharmacists, in other practice settings, and with other healthcare professionals. And collaborative care now is the in thing. Managing patients collaboratively is what is being done now in many practice settings. So pharmacists in collaborative care are particularly valuable in ensuring that patients receive the right medications at the right dosages in an optimal manner, while also helping to educate them about their disease states and medication. So it's all about rational use of drugs for the patients when we are managing them collaboratively. Sensitizing and encouraging research in community pharmacies. I've talked a bit about research, but I also need to mention that despite the fact that we have this data, there are ways to carry out research. Research is basically a systematic and investigative testing and evaluation, including research development designed to develop or contribute to generalizable knowledge. When the proper steps to carry out research is followed, whatever results we have can be generalized. For instance, if I carry out now the Google form that is going out, if I get the responses and I'm able to show you what our responses are at the end of the day, which is that I'll get to it. We can generalize to say, okay, these are the responses we got for the ACPN members, community pharmacists in Lagos State. We can generalize it to other community pharmacies in other states, provided we have taken the appropriate steps we need to be taking while carrying out the research. I will also get to that as we go on. This slide showcases some of the types of research that are usually being done. There is no research that cannot be done. Any question that has come up must have an answer. There has to be a way to design a project, a research project, to answer that question and make sure that we have the answers that we have. And basically, research is carried out in different ways. We have the quantitative research. We have the qualitative research. There are different ways. For quantitative research, I just want to explain it a bit so that when we decide to go into a bit of a research, we'll know what area we want to go in, which method is convenient for us, and how do we partner with others to make sure this is done. And I also want to say that research should not be done solo. It should be done collaboratively within teams and with other members outside our team. A quantitative research is a research like the one we are having now, finding out information, collecting information from respondents regarding a question or an hypothesis that has been set up within the research study. That can be done using different methods. It could be a cross-sectional study, which is a study that is done at a point in time. You collect your information from your patients at a point in time, and then you go on to analyze the responses that you have to deduct the answers from the results that you will obtain from administering of that questionnaire. It could be a longitudinal study, in which case you want to follow up the patient, and this is usually done when we are following up patients with chronic disease conditions. You are finding out what is their health status, for example, at this point in time, and you want to do an intervention, or you want to encourage them to try another alternative medication, or you want to educate them more on their disease state and encourage adherence. And after a period of time, you want to find out what change has occurred, if any change has occurred. For instance, you have a patient that has a high BP pressure now, and then you encourage the patient, you look at the medications that the patient is taking, do a medication therapy management, make sure that the therapy is appropriate for the patient, and then you encourage adherence in the patient, encourage the patient to monitor his or her BP daily, and then educate the patients on the medication they are taking, educate them on the disease state, educate them to either report any adverse events that they might have that might necessitate a change of therapy or issues like that. And in another few months, you want to compare the you have at that time with what they had at the initial stage. So you're calling the patient to find out what has happened over time. Action research study. That is something that requires a patient or the respondent to take some certain steps that will also result in a change which is to be measured over a period of time. Case control studies could be a case that is peculiar to a patient. A patient is reacting out of the norm to a particular medication, and you want to find out why that is being done. It has to do with a case with a patient, and you look at that patient and follow that patient up over time. You can even look back in time to see if there are risk factors that the patient has been exposed to or the participant has been exposed to that has resulted in that disease condition, and so on and so forth. Descriptive research is just for us to take a snapshot of time and report what you are seeing. It's also a cross-sectional study. And I want to mention qualitative research. Qualitative research is one that has, where you want to find out the perceptions of people, you want to find out their opinions about some certain situations or certain experiences they have had. So it's going to be a one-on-one discussion with those respondents where you ask them some questions, you document their responses, and then you go on and formulate some themes based on the responses that has been given from that study. So there are different ways of carrying out research. And then in the community pharmacy, it is easier to do some than to do others. This slide shows the steps that need to be taken in carrying out any particular research. The first one is to identify if there is a research problem. You identify the problem, and then you clearly define the question and formulate an objective around that question. For example, what is the perception of community pharmacies regarding the management of diabetes? Is it something that they feel patients are cooperating with their care or otherwise? What are their perceptions? What do they think? You can also find out perceptions of people about practically any other topic. So identify the problem. What do you want to solve? That is the first step to take. And then secondly, like I said, it's not going to be done by one particular person. So it will not be overwhelming to say, I'm going to identify a problem, and then I'm not going to go on to review literature. But still, a review of literature has to be done. This is like going online to look for similar topics in that area of research you want to find out, to carry out, to find out what has been done, what has been documented, what is already known, so that you don't duplicate what has been done. And then you can go ahead and then answer, because each research, at the end of the day, will give a recommendation that can become another problem. Where one research stops is where another one starts. When the research is concluded, recommendations can be made that will become another research question for another researcher. So a conducting literature review helps to know what is already out there, what is obtainable, and then to now know how to proceed with the study at hand. Next is to formulate hypotheses or research questions. And this means just turning your questions into an objective or formulating hypotheses with your question. For instance, I can say community pharmacies are prone to carrying out researches, or community pharmacies are not predisposed to carry out research studies. So that is an example of an hypothesis. So I want to test that hypothesis, and then I put out some questionnaire to find out the perceptions of community pharmacists, to find out if they are actually predisposed to carrying out research or they are not predisposed to doing that. And then after that, we choose the research design that can be used from the slide I mentioned earlier. Also, in addition to those slides, longitudinal studies can also be described as observational studies. We are observing what is going on from one point in time to another point in time. Or it could be an experimental study where there's a kind of intervention. We've had many studies that show the impact of pharmacy-led interventions in various disease states. That is an experimental study. We can do it in different practice settings. We can do it in different locations. And at the end of the day, those results will be put together. When you go to literature, you find a result that has been done in Egbeda, in Lagos State. You find one that has been done similarly in Southwest Nigeria. You find another one that has been done all over the country. So we have these kinds of research designs. And then selecting the sampling method. I won't want to bore us with that. There are so many ways of choosing a sample size that should be used for a research. And in our team, if we want to carry out research, I want to encourage that we have a statistician on board. This basically will be the purview of the statistician to make sure that we have the appropriate sample size that can be used. And it now makes our study relevant. It makes it generalizable to other situations outside of the one that we have. And then we go on, after we have done all these steps, we go ahead to collect our data. And the type of data that will be collected will be determined by the kind of research questions that is being asked. or the kind of study that is being carried out. All these are steps we do it. And then after collecting the data, we do a data analysis. Data analysis also has its own techniques. There are tools, statistical tools that we can use to analyze the collected data that we have. And at the end of the day, we'll have our results, just like what I have here. We'll still get to that. Those are the results from the questions I've asked the audience today, and those are the data that I have. And then after we have our results, we can now look at the trend of the results, interpret it, answer the question we have asked initially, and then report our findings of the study. And in reporting, usually we don't write it, we don't report it and keep it to ourselves. We are encouraged to disseminate our research findings. Disseminate it via journals, disseminate it via society bulletins, but journals are more acceptable so that it can be taken up by other people and then it can be used in their own research as well. And also it can be taken up by governmental bodies, it can be taken up by policymakers to inform policy and also result in better patient care. Now in community pharmacies, there are, like I mentioned, some research are more easier to carry out in community pharmacies than others. There are some research that usually will be domiciled in the general community. You can domicile your research in the general community. You can want to find out, like some of the, during the group talk this morning, some group went to town and conducted some point of care tests for people in the community. So you can domicile your research in the community. For people that did that, I don't know whether they did anything with the data that they got from that community, because that is a very good way of getting data from a community. It will tell you the prevalence of whatever conditions or disease state they have in that community. Whether in that community, the women are prone to having high blood pressure, or the men are prone to having some other comorbid disease, or even a non-communicable disease. Data will tell you. When we go out to the community to do researches there, it will show. And then some researches are also domiciled in the hospital. It can be carried out with patients that are in the hospital. Some can be domiciled in community pharmacies, like we are saying. It can be carried out in community pharmacies, and so on and so forth. You can carry out research in practically everywhere that you find a problem and you want to address that problem. So the types of research that can be carried out in community pharmacies, there's a slide that got missing here while I was sending this. So I'll just go to it here and speak to it. In community pharmacy, areas of research that we can easily conduct are medication therapy management studies to find out the outcomes of therapy on our patients. How are the diabetic patients, how are the diabetic drugs controlling the diabetic condition of our patients? How are the BP monitoring drugs controlling their BP? Is it being controlled? Are there other, if it's not being controlled, are there other risk factors that could contribute to that and that's making them to have those results that they have? We can also conduct adherence and compliance studies in community pharmacies. How adherent are our patients? They come to us, time and again. So we want to find out, are they being adherent to their drugs? We can do this via asking them questions and recording it, or administering a questionnaire to them and asking them to tick whatever options we want them to tick. And by so doing, we will know their states, we will know where they are, we will know how they are taking their medications, how they are complying to it, and then we can design an intervention, if need be, to encourage them to do better. Also, we can carry out pharmacogenomics and personalized medicines in community pharmacy. Peradventure, you have a patient who does not respond to conventional medicines or medications that he or she should respond to, and you want to know why. Are there some idiosyncratic characteristics of the patient? there are some genomic alterations that is making this patient to have these outcomes. This can be designed in community pharmacies, either in solo or in combination with other healthcare practitioners to get this done. Public health intervention is another one. We can champion campaigns such as immunization campaigns, smoking cessation campaigns, and then we measure what has been the effect of that campaign, what has been the effect of our intervention. If a pharmacist notices that you have so many people that comes into the pharmacy reeking of cigarette smoke, you want to find out how can you help them to try to stop smoking. You can design an intervention and then educate them about the risks and the dangers of smoking. You can put them on smoking cessation plans, put them on some medications like nicotine gum, varenicidine, which I think is what is being used to stop smoking, to encourage people to stop smoking. And then let them go through that plan. There's a plan for it to help patients to stop smoking. Let them go through that plan, and at the end of the day, you measure how many of them were actually able to either reduce their smoking or to stop smoking. We can measure also the impact of health education and counseling effectiveness on our patients in our community pharmacies. And the way we do this are through observational studies. We could use a case control studies. We could use a retrospective study, which I didn't mention earlier. That is going back in time to find out what has happened before. And then you are bringing it to the present time to draw conclusions regarding the condition of the patient. A randomized control study can be done where you want to find out the impact or the effect of an intervention. And you have two arms. You have an arm that goes through the conventional treatment, and you have another one that goes through the intervention that the pharmacist is offering. And at the end of the day, you compare the two results to see if there was a difference that was made. So these are services and research studies that could be done in community pharmacies. And at the end, we collect our data. Also, in collecting data, in addition to the one-on-one intervention or the administering of questionnaires to patients, we can have follow-up phone calls. We can actually get our data through phone calls for patients who might not be predisposed to come in as we want them to. We can use our pharmacy records from our computer and digital systems that we have, get the data from there, set up our research, design, and study, and then go ahead. And then we measure our results, which are our outcome measures. And the importance of defining these outcomes cannot be overemphasized. We have to know what question we are answering, what we are aiming to be able to have at the end of our research. So going to the Google link that I sent to ask some questions, I want to show us that this is actually how it works. This is a very simplified way of carrying out research, asking questions and then getting your results in real time. And then you'll be able to see, this is a raw data. Please wait. Can you please go to the, okay, this is the first one. Okay, good, I have 70 responses now. So this shows me that 71 responses. This shows me that in this hall, we have 50% of females and 50% of males. Please, can you scroll up a bit? And then this goes on to show me that it shows the demography of pharmacists that are seated in this hall. We have 52% of pharmacy owners. And at the end of the day, we can relate the status of the pharmacist to the questions that will be answered later during the research. So we have 42% thereabouts that are superintendent pharmacists. Please go up. Go up, please. Here we have a majority of us having practiced for more than 10 years, about 70% of pharmacists. So we have our elders in the pharmacy profession here. What type of pharmacy services do you offer in your pharmacies? This is a range. I can actually pull out this raw result and make a very beautiful data that will be very explicit as it's being looked at. You'll be able to deduct what happens there. For instance, we have 56% of our, no, 80% of our respondents here offering medication therapy management in their pharmacies. That is very good. I hope we have the data and we can do something with the data when we leave here. Then we have only 12% carrying out immunization services in their pharmacy. We can improve on this. And, this can be a point to inform policy that pharmacies are easily accessible and they are able to administer immunizations to people that need them. And then the policymakers will look at it and say, oh, only 12% of pharmacists are doing this presently. What can we do to encourage more pharmacists to tap into this resource? And that is how policy is informed. Please go up. Let's see the next one. Here we have 49% of pharmacists not being involved in any research activities in our pharmacy. What are we going to do differently after this workshop? We can collaborate with others. And like I mentioned, the ACPN has a research platform that we can tap into. We can form different groups. Please form different groups. Collaborate with pharmacists in the industry, pharmacists in the academia, pharmacists in research institutes, and let's put our researches out there and then showcase the profession of pharmacy more than the way we are showcasing it presently. Please go up. This question asks that the nature of research you've been involved in be chosen for those who have been involved in. And we have 51%, about half of those who have been involved in research saying that practice-based research, that is point of care outcomes, okay, kind of point of care test. Did we document this? Do we have a data? If it's not more than 1 year since we collected that data, we can still turn it into a research. Please see the chairperson and we can do something about that. How frequently do you engage in research activities? 33% said never. That's the highest percentage. Never. Please let me do my work very well and encourage us to start engaging in research post-CEC 2025 conference. Please scroll up. What are the main barriers to engaging in research in your pharmacy practice for those who are not engaging or those who have not been engaging? The highest response here says that uncertainty on how to initiate a research, something like that. That is what that question is talking about. So I see that from this question, we want to do research, but we don't know how to go about it. Now we know how to go about it. Please reach out to the research team, the ACPN research team, and then we can form cohorts of research teams that can carry out research. The data you have, you are not doing anything with it. Give us. We will use it and we will bring it into a beautiful research paper that will be published in a journal that you will see and you would be encouraged to carry out more research. Please scroll up. Can we go up again? Okay, this says, have you ever conducted your own research? 79% said no. Good. That's not a bad response because you might not be able to conduct a research solo. So we can also team up, like I've been encouraging, to get some of these researches done. So this is just showing us what can be done when we want to carry out research. There are different ways of doing this. It might not always be through this format. It might be through other formats, all the other research designs. There are others outside of what I've talked about today. I've been asked not to make it too academic so that we will not be too bored. If you have conducted research, how did you go about it? This is an interesting question. And it says 40% of people or pharmacists as part of an academic program or degree. So I think those who have higher degrees or those who have had researchers coming to them to help out to fill their research instruments. All right, so that's good. So these are just basically the simplest way to carry out a research. You go through the steps, have your research question, design a research study, get your sample size, get your population. You don't merge too many populations together. For instance, I cannot carry out a research using hypertensive, diabetic, and HIV patients at the same time. Unless I want to measure something that is peculiar to the three of them, or I want to find out how one disease state affects the other, or how one medication being used in one disease state affects the other. So there are designs and ways to do this. So measuring research and service impact. Going back to our case scenario. Now, evergreen community pharmacy. Now, I don't know if there's any evergreen community pharmacy here. If there is, apologies, I don't mean to plagiarize. This is just an hypothetical community pharmacy. So they set up a research team to address the gap that they'd realized at the initiation of this study. And that research, they carried it out among elderly patients. And that revealed that through regular follow-up calls, calling the elderly patients, counseling them, doing a medication review for them, encouraging them on adherence to their medications, they were able to have an increase in adherence rate by 25% over 6 months. So there will be less disease or uncomfortable situations for the elderly patient, and then they will be in a better state of health. And the findings were presented to the stakeholders in that community. They went on to implement a system-wide medication management program. Having realized that doing so benefited Evergreen Pharmacy, they now piloted it and disseminated to all the other pharmacies around for elderly patients. And then also, the community pharmacy collaborated with a nearby hospital pharmacy to study the impact of pharmacists on reducing adverse drug reactions. The pharmacies around the hospital discovered that patients were coming in with complaints to medications that they have taken. And so they partnered with the hospital to find out why these adverse reactions were occurring. And they were able to reduce the occurrence by looking at their medications, doing a review, and removing those medications that interacted and resulted in drug reactions. So this was a win-win situation for the pharmacy, the patient, and the hospital. And then at the end of that collaboration with the hospital, there was a 15% reduction in ADR-related admissions. So we have looked at our survey, the one that was sent out, and we have seen the trend. We've seen how many people are interested in doing research. We have seen how many people have actually gone on to do research and how many would be willing. If we go at that question, we will see that there's one that is asking how many of us would be interested in partnering with other colleagues in carrying out a research. So I will pass these responses to the chairperson, and they will look at it and act on it based on what our responses has been. So building a framework for long-term research engagement. I'm here to encourage us to do more research. I'm here to encourage us to do more collaborations, do more partnering in carrying out research in our locality and with other healthcare professionals. ACPN's research team is called Ethics, Research and Documentation Committee, and they are saddled with the goal of transforming community pharmacy practice into a more research-oriented one. So reach out to the chairperson and you can be part of this as we all collaborate to work together. I just want to showcase some of the research that has been done in my institution by some of my colleagues among community pharmacies. This study was carried out among community pharmacies in Lagos State to document their adverse drug reactions reporting rates. So it was a questionnaire-based study. The questionnaires were administered to community pharmacies over a period of 4 months in 30 community pharmacies in 4 areas of Lagos State: Ikorodu, Victoria Island, Surulere, and Ikeja. So the questionnaire contained questions that were assessing the reporting rates of community pharmacies regarding ADR that they see in their patient and how often they report these ADRs to the relevant authorities. So the results showed us that over 96% of the pharmacies reported that they agreed that spontaneous reporting of ADRs is necessary. Okay? But only 24% of them actually go ahead and report. So others were not inclined to reporting. And then at the end of this study, the conclusion is that the knowledge of ADR reporting by community pharmacists needs to be improved upon to encourage more reports of adverse drug reactions. This is another study. The first one was carried out by Foluke et al. In 2023. This second one was carried out by Ph.D. et al. In 2020 to study the pharmacists' perception of their roles and involvement in coronavirus disease when we had that pandemic. So this was also, it was an online survey. The questionnaire was sent out just like it was sent out today to 384 pharmacists. And at the end of the day, we actually got 716 responses from the survey. The results showed more females than males. It showed that the mean age of respondents was 39%. We can deduct something from there to say younger pharmacists had more knowledge of COVID. And the most common roles that were reported were counseling and advice regarding the conditions. So there was also a conclusion in that study. The third one was a community pharmacist's perception of their role in the management of TB-DM comorbidity and the barriers to provision of care in Lagos State. So we also had a lot of responses from there. And the conclusion was that the study revealed that community pharmacists in Lagos State have a positive perception towards managing TB-DM comorbidity. I don't know if I'm right. Am I right? That was the response we got. And then continuous care will promote safe, effective, and optimal treatment outcomes in these groups of patients. And the last one, management of acute diarrhea in children by community pharmacists in Lagos State. As the title implies, it was carried out to determine how community pharmacists manage acute diarrhea in children. The study, the method was also through a self-administered questionnaire. And at the end of the day, the conclusion was that the assessment of patients to determine acute diarrhea was inadequate. Conclusions are always drawn from the data that we get from the research. So, and it is this conclusion that we put out there to inform other colleagues and policymakers. So also emphasizing that community pharmacists needed to, that there's a need for intense campaign on the management of acute and watery diarrhea in Lagos State. These are some of the studies that has been done. There are so many others. These are some of the references that I used in preparing these slides. Thank you for your time.
Thank you. Please, a round of applause for pharmacist Dr. Foluke Ayeni. Thank you very much.